In this video, we'll explain massive rotator cuff tears. The rotator cuff is a group of 4 muscles that control the ball and socket of the shoulder joint. They include the supraspinatus at the top, subscapularis at the front, and infraspinatus and teres minor at the back of the shoulder. Rotator cuff tears are common, especially as we get older. If you take 60-year-olds who think nothing is wrong with their shoulder and you scan their shoulder, half of them will have a rotator cuff tear and not know it. A massive rotator cuff tear is defined as a rotator cuff tear that involves 2 or more tendons. Massive rotator cuff tears tend to be degenerate and happen slowly over time. As the tear progresses, the muscles around the shoulder in the rest of the rotator cuff compensate for the torn tendons. In some patients, after a minor injury or other medical problem, their shoulder can decompensate and they develop pain and loss of function. The first line of treatment for a massive rotator cuff tear is a special exercise program done by your physiotherapist called a deltoid retraining program. This exercise program aims to strengthen the deltoid muscle and allow it to compensate for the torn rotator cuff tendons. In some patients, pain is a predominant feature of a massive rotator cuff tear, and they're unable to do physiotherapy exercises. In those patients, we may use an ultrasound-guided suprascapular nerve block, which is a special injection to numb the nerve that supplies pain to the shoulder joint. And we use this nerve block as a test. If the nerve block takes the pain away, we can refer you to a pain specialist for a suprascapular nerve ablation, which gives longer pain relief. And once the pain is controlled, then we can try the deltoid retraining program. In some patients, if these non-operative measures don't work, the definitive treatment for a massive rotator cuff tear could be a special type of shoulder replacement called a reverse shoulder replacement. This operation replaces the shoulder joint much like a knee or hip replacement, but it's called a reverse shoulder replacement because we turn your ball into a socket and the socket into a ball, and that way the deltoid muscle compensates for the torn rotator cuff tendons. Thanks for watching this video.